Have you ever felt that feeling? When your legs feel a little heavy or maybe tired after a long day of standing? Or perhaps you notice those little swollen veins peeking out on your legs? Well, the truth is, a lot of us have, and it can be a little concerning. What we're talking about today is a super common condition called chronic venous insufficiency, or CVI. Honestly, it sounds pretty complicated with a name like that, but let's break it down in a way that actually makes sense. Chronic just means it's a long-lasting thing, not something that happens and then goes away. Venous is about your veins, those amazing little pathways that carry blood back to your heart. And insufficiency? Well, that's just a fancy way of saying your veins aren't quite working as efficiently as they should. So in simple terms, CVI is when your veins have trouble sending blood back up your legs to your heart. Now let's be real. A lot of health content out there can feel a bit clinical and cold, but I want to talk to you like a friend. I want to empower you with knowledge so you understand what's happening in your body and what you can do about it. The more you know, the more in control you feel, right? So how does this all work? Think about your veins for a minute. They're like a one-way street for your blood. Your arteries bring fresh blood and oxygen down to your feet and toes. But the veins have the harder job. They have to fight gravity and push that blood all the way back up to your heart. And they have a special system to help them do it. Inside your veins are tiny little doors called valves. These valves are incredibly important. They open to let blood flow up and then snap shut to prevent it from falling back down. It's an ingenious system, honestly. Your veins actually have three main systems in your legs that work together. The superficial veins, which you can see just under your skin, the deep veins, which are tucked away inside your muscles, and the perforator veins, which connect the two systems. All of these veins have those one-way valves, making sure the blood keeps moving in the right direction, back to your heart. But the biggest help your veins get comes from your muscles, especially your calf muscles. Think of your calf muscle as a powerful pump. Every time you walk, every time you take a step, that muscle contracts and squeezes on the deep veins inside it. That squeeze creates a pressure that acts like a powerful push, propelling blood back up towards your chest. It's called the calf muscle pump, and it's absolutely vital for healthy blood flow. A friend of mine who's a nurse once said, "Your calves are your second heart," and I always thought that was a great way to put it. So, what happens when something goes wrong with this system? Well, when those tiny valves inside your veins get damaged or weak, they can't close properly anymore. Instead of staying shut and keeping the blood flowing forward, they become leaky. This means that when blood tries to go up, some of it falls back down, pooling in the lower part of your legs and creating pressure. This is the root cause of chronic venous insufficiency, and it leads to what's called venous hypertension, or high blood pressure inside your veins. Honestly, a common cause of this valve damage is a condition called deep vein thrombosis, or DVT. You may have heard of it. It's when a blood clot forms in one of your deep veins. Maybe you've had a friend who had one after a long flight or a surgery. While not all blood clots cause CVI, a DVT can certainly damage those delicate valves, setting off a chain reaction. The damage isn't always immediate or noticeable either. Sometimes a DVT can happen without you even knowing it, and the valve damage slowly gets worse over time. But DVT isn't the only cause. The truth is, sometimes our genes just play a role. Maybe your parents or grandparents had varicose veins. Sometimes you just inherit a tendency for your veins to be a little less sturdy or your valves to be a little less weak. A neighbor of mine has this, and he's always telling me it's just a family thing. Pregnancy is another big one. It used to be thought that the baby just pressed on the veins, but now we know it's also a hormonal thing. The hormone progesterone, which is essential during pregnancy, can actually relax the walls of your veins, making the valves less effective. This can contribute to vein problems that sometimes stick around long after the baby is born. Obesity is also a factor. The extra weight can put a lot of pressure on the veins in your legs and abdomen, making it harder for blood to flow back up. And let's be real, a lot of us are dealing with this. A sedentary lifestyle, where you're sitting or standing in one place for long periods, can make it worse. Think about a cashier or someone who works at a desk all day without getting up to move. Without that calf muscle pump working, the blood can just sit there. Even things like a previous injury, like a broken ankle that keeps you from walking, can be a cause. When you can't use your calf muscle pump effectively for a while, it can lead to venous hypertension. So you see, it's a mix of things. It's not always just one single cause, but the end result is the same: leaky valves and a buildup of pressure in your veins. That increased pressure, especially in your superficial veins, is what causes those telltale signs we often see, like varicose veins, swelling, and that feeling of heaviness.
But the important thing to remember is that you're not powerless here. Understanding what's happening inside your body is the first step toward taking control and managing it. We can't change our genes, but we can change our habits and our actions. And that's what we'll get into next, so stick with me. You know, when you have chronic venous insufficiency, that high pressure in your veins isn't just a cosmetic thing. It actually creates a domino effect. Think about it like a traffic jam on a highway. If the main highway, your deep veins, is backed up, all the smaller roads, your superficial veins, start to get congested too. And that backup eventually reaches the very smallest roads, the tiny capillaries that deliver oxygen and nutrients to your skin. The truth is, this increased pressure in your capillaries pushes fluid out of the vessels and into the surrounding tissue. Have you ever noticed your ankles or feet getting swollen, especially at the end of the day or in the summer? That's what's happening. We call it edema, and it's one of the first and most common signs of CVI. For me, I notice it when my socks leave a deep indentation in my skin. Honestly, it's not just uncomfortable. It's a sign that something is going on with the pressure in your lower legs. As this fluid continues to leak out, it can cause other issues too. That constant fluid buildup and poor circulation can actually change the texture and appearance of your skin. It might start to look dry, thin, and kind of scaly. Some people get a red or brownish discoloration, usually around the ankles. It's called stasis dermatitis. A friend of mine who's a doctor once said it's like the skin is getting starved of what it needs because the blood isn't moving properly. The skin can get itchy and irritated too, which, let's be real, can be a real nuisance. And if that wasn't enough, that same poor circulation can make it harder for your body to heal. Minor scratches, scrapes, or even bug bites on your lower legs can take a very long time to get better. If left untreated, this can progress to something more serious, like a venous ulcer. These are open sores on the skin, typically around the ankle, that can be slow to heal and are at risk for infection. This is a big reason why doctors take CVI so seriously. It's not just about the way your legs look, it's about preventing these more severe complications. Now, maybe you're sitting there thinking, well, what can I actually do about it? The good news is there's a lot you can do to manage the symptoms and prevent the condition from getting worse. This is where you get to take back some control and empower yourself. The first and probably most important thing you can do is to get moving. Remember that calf muscle pump we talked about? You want to use it. Honestly, a simple walk is one of the best things you can do for your legs. When you walk, your calf muscles contract and relax, squeezing those deep veins and pushing that blood back up. You don't have to be a marathon runner. Just walking around your house, taking a stroll outside, or even marching in place while you watch TV can make a big difference. I've done this myself sometimes when I'm stuck inside and can't get out for a proper walk. It helps, it really does. Another simple but effective strategy is elevating your legs. This is all about using gravity to your advantage. When you're sitting, prop your feet up on a stool or a chair. If you're lying down, you can put a pillow or two under your feet. Aim to have your feet higher than your heart. Doing this a few times a day for just 15 to 20 minutes can help drain some of that pooled blood and reduce swelling. The NIH 2022. It's a great habit to get into, maybe while you're reading a book or talking on the phone. The next thing you should probably consider is compression therapy. This is a powerful tool. Compression stockings are designed to gently squeeze your legs, helping to improve circulation and prevent blood from pooling. Think of them like a supportive hug for your veins. They're tightest at the ankle and gradually get looser as they go up your leg, which helps push blood back up toward your heart. I know they can be a bit of a hassle to put on, but they really do work. You can buy them at most pharmacies or medical supply stores, and they come in different strengths. Your doctor can help you figure out what's right for you. Honestly, I've seen them make a huge difference for people, reducing swelling and a lot of that heavy feeling. And finally, let's talk about your weight. If you're carrying extra weight, losing even a small amount can significantly reduce the pressure on your veins and improve blood flow. I know this isn't always easy, let's be real, but even small changes can add up. Making healthier food choices and adding more movement into your day can make a big impact, not just on your weight, but on your overall circulation. I think the key message here is that CVI is a chronic condition, but it's not a condition that you have to suffer through without relief. By being proactive and making some simple lifestyle changes, you can take back control. The goal isn't to be perfect, the goal is to be consistent. Every little bit of movement, every time you elevate your legs, every time you put on those compression socks, you're helping your body out. You're giving your veins a break and helping that amazing circulatory system do its job. It's about small victories,
So whether you're dealing with a little swelling or more serious issues, these are steps you can start taking today. They're safe, they're simple, and they're effective. So what do you say? Ready to start giving your veins the support they deserve? Now, let's be real. Living with a chronic condition like CVI can be frustrating. You might have to make changes to your routine or wear things like compression stockings, which honestly aren't always the most comfortable. But the truth is, a big part of managing CVI is making simple, consistent changes to your daily life. And that's what we're going to talk about now. Some practical ways to not just manage CVI, but to live well with it. First, let's talk about those compression stockings. I know they can be a pain to put on, but honestly, they are one of the most effective tools we have. They work by applying gentle pressure to your legs, which helps keep that blood from pooling and supports those weak valves. Think of them as giving your veins a little hug to help them do their job. When you put them on first thing in the morning, before you even get out of bed, it can make a big difference. That's when your legs are least swollen, and it makes it a lot easier to get them on. You can find them in different compression levels, and maybe, just maybe, you can talk to your doctor to find out which level is best for you. Next, let's talk about food. Now, there isn't a magic diet that'll cure CVI, but there are definitely foods that can help your overall vein health. A lot of this comes down to managing things like inflammation and maintaining a healthy weight. Try to eat a diet rich in fiber to prevent constipation, because honestly, straining can put pressure on your veins. I seen this with a neighbor who had CVI and a lot of issues with constipation, and it made his symptoms worse. Also, include foods high in flavonoids, which are plant compounds found in fruits and veggies. Some studies have shown they can help strengthen blood vessel walls. So things like berries, grapes, leafy greens, and citrus fruits are all great choices. And of course, stay hydrated with plenty of water. What about exercise? We've talked about walking, and I can't stress enough how important that is. But there are other exercises you can do even if you're not up for a walk. How about some simple ankle exercises? You can do them while you're sitting at your desk or watching TV. Just move your ankles up and down, pointing your toes, and then flexing your feet. You can also rotate them in circles. This helps activate those calf muscles and gets the blood moving. It's a small thing, but it's a powerful habit. A friend of mine once said that just doing this for 5 minutes every hour helps her legs feel less heavy, and honestly, it's worth a shot. Let's be real about standing and sitting. If your job requires you to be on your feet or sit for long periods, it's a good idea to take breaks and move around. If you're standing, shift your weight from foot to foot or do some calf raises. If you're sitting, get up and stretch or walk around the room for a minute. The goal is to avoid being completely still for too long. You can set a timer on your phone to remind you to get up and move. This is a game changer. And a quick note about your sleep. Have you ever felt this way, when you wake up in the morning and your legs feel a little better? A lot of that is because when you're lying down, gravity is no longer fighting against your veins. So honestly, you can take advantage of that at night. Maybe put a pillow or a foam wedge under your feet to keep them elevated a little. This can help reduce that morning swelling and keep your legs feeling their best. Finally, remember to be kind to yourself. CVI is a chronic condition, and there will be good days and bad days. The goal is to manage it, not cure it. That means you should listen to your body and know your limits. If your legs are feeling extra tired or swollen, maybe take a rest and elevate them. Don't push yourself too hard. Have you ever felt that way, where you just had to stop and listen to what your body was telling you? Acknowledging those feelings and taking the time to care for yourself is a sign of strength, not a sign of weakness. The truth is, while there are a lot of factors that can contribute to CVI, you have a lot of power to manage it. By adopting these healthy habits, from wearing compression stockings and moving more to eating a healthy diet, you're doing everything you can to help your veins and improve your quality of life. You're not just a passive participant in your health, you're an active partner. And that, my friend, is something to be proud of. So let me ask you, what's one small step you can take today to give your veins a little extra support? Let us know in the comments below.